Sunrise Extra on a Wednesday.
Whoa!
We weren't sure. Looks fine.
We weren't sure how this was going to look. We have some new graphics that we're using to create these boxes. We're actually not, as you can tell, we're not actually standing this close to each other.
It looks like it.
But it looks like we're shoulder to shoulder.
It looks better. You can see us better. Yeah. Hi everyone. We're a bunch of little dorks. Okay, so we are talking about, yes, you see the headline there. Some Oregon hospitals are allowing COVID positive employees to return to work. I'm trying to be serious.
I know you.
Okay, here's the deal. We're going to play a Catherine Cook story for you that it really explains this. It has to do with legacy health employees because we've seen the influx of people in hospitals. There's not enough staff in every industry, and this is how Legacy is dealing with it there. Roll that package. Now, let's take it now.
You thought we were going to play it. See that, Nina? You got too serious, too quick.
Spring 2020. It's been almost 2 years since people supported healthcare workers like this. Support many providers feel devoid of now. One Legacy health nurse who asked to remain anonymous told KGW, "We feel forgotten, devalued, and taken advantage of. We are exhausted, working in unsafe conditions, short-staffed, and with very low morale." Those feelings, the nurse tells us, are exaggerated by this new COVID guidance policy. Legacy Health sent it to employees on Friday. It says employees who test positive for COVID can now come back to work 5 days after the start of their symptoms if those symptoms are mild enough to be controlled by over-the-counter medication. In short, employees who have COVID and are still symptomatic can now treat patients. With staffing shortages, Legacy Health officials say it's a no-win situation that led them to a tough decision.
We put our staff safety on par with our patient safety.
Legacy Senior VP and Chief Medical Officer, Dr. Seth Podolsky.
We are increasing risk tolerance to be able to care for the folks that so desperately need it. If we don't do that, we are going to find ourselves in crisis standards of care much faster as a region.
As it stands, many healthcare systems are working under contingency standards, which under CDC guidelines allows healthcare workers with COVID who don't have symptoms to return to work after 7 days with a negative test, or fewer days without a test if there are staffing shortages, something the public may not be aware of.
Suggesting that healthcare providers may indeed be symptomatic after having tested for COVID. How do you plan to disclose that to patients?
So we don't have any current plans to disclose. That could change. I don't know of other health systems in our region, Catherine, or the country that are doing that. Again, because what we know about the highly transmissible nature of Omicron.
Legacy and hospitals nationwide are facing a workforce slashed by illness and understaffing. At the same time, they're treating more people. In California, state health officials just announced hospital staff who test positive but don't have symptoms can also continue working. Rhode Island and Arizona have similar guidelines, and the list is growing.
Nurses are very concerned.
Kevin Mealy is with the Oregon Nurses Association, a union that represents many nurses in Oregon, although not those at Legacy. He says their concerns extend well beyond Legacy's policy. He points to the CDC's 5-day return to work without a test guideline. Those changes followed studies that show while Omicron may spread more quickly than other variants, it may also produce milder symptoms. However, the CDC also notes that even after 5 days, around 30% of people remain infectious.
And so when you take a nurse or frontline provider from being part of the solution as a caregiver and turn them into part of the problem as someone who now has COVID, you've really exponentially worsened the overall problem.
They're short-staffed and they're so overloaded by patients. Do you think those are reasons to continue with this line of thinking?
So there are more steps to limit the exposure of the healthcare workforce and prevent them from getting sick to start with before demanding that they work sick.
Neely says those steps should include improving internal testing and exposure notifications, limiting hospital visitors, and requiring N95 masks or equivalent across the board.
Hospitals are the place we go to get care and to get well. We don't want it to be a place that continues the spread of COVID-19.
Catherine Cook, KGW News.
Catherine's story totally caught my attention. It was the first thing on our KGW
What's kind
app.
of your take on it? What do you think?
Well, the first question I had, and I think a lot of people have that question, is, what do you mean you're not going to tell the people who are coming in?
I thought that was a big part of it too.
I have always said, Drew, and I kind of joke about it, dark humor, if I get COVID, double vaxxed and boosted, I'm not going to let it be a secret. I'm going to let my whole station know, just in case, because as things kind of go through the process, sometimes you'll get a call, or they'll, HR will say, hey, you've been exposed, but not a close contact. And we can't say, please respect privacy. I'm giving everybody permission. You spread the word. If I'm sick, I want you guys to know about it. So if I go into a hospital for whatever standard procedure, I would at least like to know that so I can make my own decision. Maybe you're there, maybe you go in regardless, doesn't matter to you. That's fine, but I think you should be transparent.
Right. I mean, I think the story was initially about healthcare workers and what they're having to deal with right now and the concerns they have. But like you said, I think that takeaway speaks to more people, right? That's the general public. That's going to impact thousands of people.
And all of you guys watching, thank you so much for weighing in. And boy, you are letting the comments fly. Jennifer Taft, good morning to you, one of our regulars. She says, I support vaccines, but they're terminating employees for not getting vaxxed. And now they're going to allow sick employees to return as vaccinated to return. Period. As a vaccinated, immunocompromised person who now has 4 vaccines, I feel like I'm part of some awful group project where I'm doing the work, and this is the slap in the face I didn't need. I feel betrayed, angry, sad. I'm over the economy being, better than humans. It's not their fault. For medical workers, it's a failure from the top.
And then Shauna says maybe it would have been better to keep all of the fired healthcare workers, the unvaccinated ones, instead of having positive healthcare workers work and work
COVID
sick.
positive.
Work sick. So they can infect people. That's a question mark. I would rather have unvaccinated, healthy people taking care of me than a sick, contagious, vaccinated person. That's Shauna. Janae Kyler.
And I wonder how, in Catherine's story, she talked to an anonymous nurse who was upset by this. And then we talked to the Nurses Association, who apparently does not represent legacy employees. But I wonder what if you were to poll staff, legacy staff, what would the breakdown be of fine with this new policy or very against it? Because there was a lot of people. We had an article on our website yesterday, and it was kind of a national piece about the breakdown of sick leave. And a lot of people are taking these at-home tests. You should, they say, report your results if you do test positive at home to your doctor or something, so we have more of a real count. But a lot of people are taking these at-home tests at home. If you test positive, you don't have to tell anyone. A lot of people aren't telling anyone, and they're going to work with mild symptoms but sick because they don't have sick leave and they don't want to have their paycheck be cut, by staying home or quarantining. And so it said a lot of workers, only a third of workers in the lowest tier wages get paid sick time. But 95% of the workers in the upper salary range have paid sick leave, and so they stay home because you're still getting paid. But a lot of people test positive and they quietly go to work.
Right, that's a systemic failure. I mean, it just kind of exposes so many things. We had this conversation when the pandemic first started, because before we realized the full gravity of it, we had, some employees who were like, I'm not using my PTO, for if I'm perhaps sick or think I might have been exposed. So that's a rough one. I mean, I get that though. Lower wage workers, they count on that money. That is am I gonna have enough to pay rent or to, get groceries or whatever their expenses are?
I would imagine healthcare staff has PTO, sick leave of some kind, being in the field, medical field. I know some workplaces, if you can show you got exposed or you got COVID from work or during work, then that time is not taken off your PTO or vacation. It's paid time off at home to be sick. But if you can't prove it, then you are using your vacation or sick leave.
And sometimes you're fortunate enough to have a job where you can go home and still work, and they'll let you work from home.
Yeah.
Obviously, that's not always the case. It is interesting, right? We are seeing more cases now than we ever have at any point in the pandemic. I mean, that's by far and away the case right now. But by making all the testing now easier, so to speak, with the at-home tests and whatnot, they pretty much have broken the contact tracing system. Right? I mean, we
It's
have more.
impossible,
We have more cases than ever, but we can't contact trace anymore.
Yeah.
Back when we had,
I think they
62
stopped doing
cases,
that. Did they
Well,
not?
They did. The Oregon
yeah,
Health Authority.
a long time ago.
Now, some schools are still trying it in some cases. You know, schools will individually try to do the contact tracing with its students, but yes, as a whole, the state is not doing it.
Stanford Walker says, sounds like all about the almighty dollar, not patients or employees.
You had that question, Brenda, a little bit, right?
I did. You know, I was just trying to noodle through, like, why
would they
a
do this?
hospital do that? You know, like, what was the real motivation? Is there something between the lines, you know, between what they're saying and the actual reason? I'm like, do they just want to keep patients coming in the door? Like, why would you want sick employees who are symptomatic with Omicron coming to work?
I mean, they have all the PPE there.
Yeah.
They're covered up, and they say if you can mask the symptoms with
Masking the
Sudafed or
symptoms,
whatever,
that's
you know, so
brutal,
you're
yeah.
not sneezing
I don't think it's
or
a
hopefully
mask,
you're
but-
coughing.
No, but that's what that means.
Mild
If you can
symptoms,
control
right.
the symptoms with over-the-counter
Then you're
meds, then you
okay.
can come in.
Yeah.
I don't know. It doesn't seem like a good idea to me, but
Yeah.
you know.
But it is interesting, and we're seeing this in so many industries. Like, it just snowed like crazy, you know, over the Cascades in the past couple of weeks.
Yes.
All of the passes from east to west in Washington were closed at one point. Highway 20, 84, 26 were closed at some points. And, you know, a lot of the times we fail to mention, remember ODOT said they have over 100 snowplow positions open. There's
good
not enough
point.
people working there, but also they are one of those industries that let people go because they are state workers who weren't vaccinated. Now, it's probably not the number of positions that they have open. It's probably a small percentage of their staff that were terminated because they were unvaccinated, but it factors in.
Willie Huey makes a great point, I think. He says no one should be surprised that America is the one telling their workers to go to work sick. It has been this way for 200 years. I was surprised it took this long to happen.
Yeah.
Well, he's always good for the good point.
Yeah, he is. I mean, that's straight to the point.
And I think it's interesting that legacy spokesperson in Catherine's story said, you know, it's just in order for us not to right now get to that crisis healthcare mode, where they really have to only prioritize the people who will benefit the most from a ventilator or a hospital bed. They have to increase the risk factors. What was the word he said? Increase
Is it risk tolerance?
That's right. Increase their risk tolerance right now by bringing in those people who have mild symptoms.
And
in order to not
Jackie
get to
says,
crisis.
yet if a family member is in the hospital, family can't visit? This makes no sense to her.
Yeah, yeah, and it's kind of it's a good point.
Yeah, Kristen Lubensky, kind of echoing that point from Willie Huey earlier. Kristen says, remember 2 years ago when it was finally becoming acceptable to not go to work when you were sick? I thought maybe our culture would change because of COVID in that regard. Stay home when you're sick, period. She says then, apparently not.
Well, I guess for those legacy employees, I mean, so far this is just a legacy policy. We haven't heard of other hospital groups or clinic groups doing this. But I guess if, you know, the employees who are against this policy, and if they do happen to test positive, all you have to say is, I got worse symptoms, you know, than cold medic. I'm just going to stay home.
Anna Oliveris says, I'm pro-vax, but think it was short-sighted to fire non-vaccinated healthcare workers. You know, it's interesting when you talk about people coming to work sick. I got to say, I really do appreciate the two of you, because you said, you know, you got a cold from your daughter, Drew got a bad cold over Christmas, but you both took a COVID test before you came back in the building.
Yeah.
And you
have
know what?
to.
I mean, well, not everybody
I mean,
does.
you don't have to, unfortunately, but yes.
Because, you know, Drew, you were saying it was like, oh my gosh, I've been so good, like I've been totally healthy, and now I get this cold. Is it COVID?
It was weird for me, honestly. I got a booster shot on the Monday after Christmas. I tried to get one the week before Christmas, and that fell through with my work schedule. Well, bottom line, I got the Monday after Christmas, and the very next day I felt very sick. And I thought, this cannot just be a booster reaction. I didn't have a reaction after the first 2 shots, not like that anyways. So it was just very weird, like, what's going on? You know, that was like day 1. And then day 2, sore throat. I'm like, what the heck? Am I getting a cold? Like, I haven't had a cold since 2018. What, do I have COVID? What the heck is going on? Then everyone's getting these positive tests left and right. So yes, on Friday, I finally was like, I don't want to do an at-home test. I don't trust my ability to administer it myself. I'm going in, I'm having a professional administer a test. And we did it, and it was funny because she's like, oh yeah, you have all the symptoms that everyone seems to have right now that is coming in and getting tested, and many of them are positive tests. Mine came back negative for both flu and COVID, thankfully. But I did think that was Friday. I was like, I have to do something. I can't just show back up to work right now with this complete unknown hanging over my head. I thought we were way past it. There's more questions now than there were at the beginning. The beginning was pretty simple. Shut it down. Stay home.
Yeah.
Now there's all these question marks.
There is, but I mean, it is one of those things where the virus is changing.
Yeah.
Now they being all the powers that be in different administrations in public health, made some bonehead mistakes. They did some things right, but they also made some bonehead mistakes, and they said some things that either they knew not to be true or that turned out not to be true. So people start to lose confidence in what they're saying. But what I know is that that virus is mutating and changing, and nothing is certain. It's like everything that we thought we knew with Alpha, and then, you know, with Delta, oh, that's the worst. Well, now we get Omicron, which is like super contagious, milder.
Right.
For most people, but it's just like all bets are off. You just, as soon as you count on something, it changes.
And people are counting on things. I mean, that's because that's what you hear right now. You know, the first thing a lot of people say is, oh, well, it's just the Omicron variant. I'm not concerned about it. The symptoms are mild. And, oh, this is a weaker version. The next variant will probably be even weaker. Who the heck knows that?
Yeah,
nobody
we do
does.
not know that.
Right,
If we know anything, it's that we don't know anything yet. Heading to our YouTube stream, good morning to everyone watching us on there. We have a couple of new viewers. David Zurcher, good morning to you. We're looking at our phones because this is how we see your comments. This is how I'm reading you guys on YouTube. Brenna and Drew are keeping track on Facebook, just so you know the deal. Kim Tannehill, one of our regulars. Good morning to you, Kim. She says, coming to work in the healthcare system while having COVID, even if it's allowed, has got to be like crossing the picket line for their coworkers. That's kind of an interesting analogy. And she also says healthcare providers do not abide by this. Say you're too sick. This isn't going to help in the long run. It's bureaucrats, not doctors, making these changes.
There are a lot of comments.
Yeah, I know. I'm trying to look through.
And some of them are
Sarah
so long.
Hazlett,
Yep, that's what I'm looking at. Yep,
says it is such a disservice to those who are already medically compromised seeking care. Allowing COVID-positive hospital workers to work will only push away people needing health care but are afraid to come to the hospital because COVID-positive people will be potentially caring for them. We need to provide a safe area for those who need medical care.
Here's a view on the other side. Kevin Lewis, good morning to you, Kevin, watching us on YouTube. I haven't seen your name before, so welcome to the show. He says, finally, some sanity. People are not dying like before. We have to end this. Other people saying, you know, they're glad that more home test kits will be available soon. We just got word today the White House is sending out like 10 million PCR and rapid tests directly to school districts to hopefully keep them more open, because we just got word David Douglas, the entire school district closing tomorrow and Friday to prepare if they were to go into online learning. They're hoping to have in-person school next week. But Drew, you were saying, you know, your kid's school, they, or the district, and a lot of districts have this policy, it seems like. They need 2 days to kind of get back into the groove and figure out online school and video cameras and all that stuff and what teachers would teach what subjects before they were to go back
Apparently
to remote.
they made that agreement, our school district did anyway, with the teachers union.
Yeah.
Before school even began, said, hey, if it comes to another situation where we have to go to distance learning, we will give you 2 days, teachers, to reset the deck and reshuffle the cards and figure out how to do that remote learning again. So, and they said, so basically, you know, if the school decides at 10 o'clock on a Monday night that we're going to go to distance learning, immediately Tuesday's no school, Wednesday's no school, Thursday distance learning begins.
Yeah. Have a plan. 'cause
Hang
that
in
is
there, you
gonna-
guys.
Yeah, no kidding.
Hang in there.
Thanks
Thinking
for
of you.
weighing in with us. Lots of comments today. We appreciate you guys. Have a
Is cherries and
wonderful-
berries on YouTube, by the way, today? Do you see any cherries and berries?
That's a great question.
Cherries and berries is a newfound friend of the Sunrise
No
Extra
cherries and
program.
berries,
Oh.
but I'm going to do 3 days in a row with a shout out to Goldfish Mama.
Nice.
Good morning to you.
Mama
Thanks for
again.
watching us. All right, bye, you guys. Have a great Wednesday.